Hello everyone, welcome back to a new session in dentistry and more. So let's continue our developmental disturbances of teeth. So last session we had covered regarding the size problem, that was microdontia and macrodontia. So today's session is about the developmental disturbances of teeth related to number. So basically we have two types, that is supernumerary and anodontia. So let's get into the details of developmental disturbances of teeth with respect to number. So the supernumerary teeth, it's also known as hyperdontia. Hyperdontia, it's more number of teeth present compared to the normal, and anodontia is loss of teeth. So first let's see anodontia, then we'll move on to the supernumerary teeth. So anodontia, we have four types. The first one is total anodontia, partial anodontia, false anodontia, and pseudo anodontia. In all cases the teeth are missing. Compared to the number of teeth are less compared to the normal regular number of teeth, that is 32 in permanent and 20 in deciduous. So what is total anodontia? Total anodontia is a complete loss of teeth. The patient is edentulous, and it is very rare condition, and it is seen in a syndrome known as hereditary ectodermal dysplasia. We know teeth is formed from ectoderm. We have seen ectoderm, endoderm, mesoderm. So ectoderm is the portion from which the teeth origin. So hereditary condition of dysplasia of ectoderm. So it results in complete loss of teeth, or there will not be any teeth at all. That is anodontia. Now we have partial anodontia. Partial means there will be few teeth are missing. It can be hypodontia or oligodontia. Hypodontia is if one or more teeth missing, we can say that is hypodontia, and 6 or more teeth are missing, we can say oligodontia. So most common missing teeth are lateral incisor, third molars or maxillary or mandibular, second premolar. So which are these? Lateral incisor, third molars, maxillary and mandibular, second premolar. Now we have false anodontia. False anodontia is when the teeth are missing, that is like exfoliated or extracted. So these two conditions, there will be false anodontia. Teeth will be missing when it is exfoliated normally, or if it is extracted for any reasons. It could be dental caries extraction, it could be orthodontic extraction, or any reasons. If teeth are missing, we can say it is a false anodontia. And another condition is pseudo anodontia. Actually, pseudo anodontia, the teeth are actually present but not clinically present. So it could be impacted, it could be delayed eruption. So these conditions, the jaw appears to be without teeth, one or more teeth, so many teeth. So that condition is known as pseudo anodontia. So teeth might erupt, it might not erupt, but teeth are there inside the gums or inside the jaw. So that is known as pseudo anodontia. It is clinically absent teeth, which is due to impaction or delayed eruption. So these are the four types of anodontia. It is a common question. One is total anodontia, partial anodontia, false anodontia, and pseudo anodontia. Total is complete loss. Partial could be hypo or oligo. False could be due to exfoliated or extracted, and pseudo, it could be clinically absent condition. So most common are lateral incisor, third molar, maxillary or mandibular, second premolar. Now we'll move on to the supernumerary teeth. Supernumerary teeth, there will be more number of teeth. It is due to the continued proliferation of permanent or primary dental lamina to form a third tooth germ. So basically we have two germs, that is one deciduous and one permanent tooth germ. So in addition to that, there will be a third tooth germ. Why it is happening? It is due to the proliferation of dental lamina. From dental lamina, we know, we have learned in tooth formation. From dental lamina, the tooth arises, so tooth origins, so continuous proliferation, so there will be additional third tooth germ. So that is supernumerary teeth. So it could be a normal tooth, a rudimentary tooth, or a miniature version of that normal tooth. So it is most commonly seen in permanent dentition rather than primary, and in the maxilla, more seen in maxilla compared to mandible. So what happens when these are present? So there will be always malposition of adjacent teeth, because this will create crowding, and it might prevent the eruption of adjacent teeth. So most commonly supernumerary teeth associated with cleidocranial dystosis. So this is hereditary ectodermal dysplasia that is related to anodontia. This is supernumerary teeth, cleidocranial dystosis. Okay, so we have supernumerary teeth classification under two headings. One is based on the location and one is based on the morphology. So based on the location, we have MESIODENS and we have fourth molar, that is either it could be a paramolar or a distomolar, and premolar. So MESIODENS is the most common one. It is seen between the two central incisors, that is permanent central incisor. This could be a single tooth or a paired tooth or an impacted tooth or an inverted tooth. So it can be in four versions: single, paired, impacted and inverted. It is basically a smaller version with cone-shaped crown and very short root. So that is MESIODENS between the central incisor. It is very common. And the fourth molar, so there will be a fourth molar. We have three molars, first, second and third. So three molar. In addition to that, we have a fourth molar because it is supernumerary tooth. So it could be a paramolar or a distomolar. Distomolar is the second most common because it is seen mostly distal to the third molar. So that is why it is known as distomolar or fourth molar. So it is also known as distodens. So patients will be having a 4 molar teeth in place of 3 molars. So this is distal to the third molar. And also there could be a paramolar, that is just additional molar, not exactly at the distal position of third molar. It could be between first and second molar, or it could be between second and third molar. It will be usually a small and a rudimentary one. So distomolar and paramolar, and also premolar. Additionally, one premolar, that is a third premolar, will be there. Usually we have 2 premolars in each side, each quadrant. So there will be a additional premolar. So this is molar and premolar. So based on the location, could be MESIODENS, paramolar, distomolar, premolar. Now we have based on the morphology. Morphology, we have 4 types, that is conical, tuberculate, supplemental, odontomes. So conical is nothing but MESIODENS. It is conical in shape. Tuberculate is like barrel shaped, tubercle shaped supernumerary tooth. Supplemental is duplicated one, and the important one is odontomes. Odontomes is nothing but hematomatous malformation. Hematomatous malformation means it is not basically a neoplasm. It is the same normal tooth tissues or normal tissues. It is multiplied in a different way. It grows in a different, unusual way. It results in a specialized structure resulting hematoma. So tooth tissues multiplies in a different way and becoming odontomes. So we have 2 types of odontome. One is complex and compound. So if we have more than one type of tissue, which is actually known as composite odontome. Composite odontome. So we have two types basically, complex and compound. In complex, so we cannot basically distinguish between any particular cells or tissues. It is totally disintegrated. Whereas in compound, the malformation where the superficial area is similar to the normal tooth. So compound is more or less like normal tooth. We can distinguish layers of teeth, but in complex it is totally disintegrated. So odontomes is nothing but a hematomatous malformation. The tooth tissue is replicated or grown in a different format, and it has two type. Composite means more than one type of tissue is there. We should call it as composite odontomes, and we have two types. One is complex and compound. Complex totally disintegrated, compound we can distinguish the layers. So that's all about developmental disturbances of teeth with respect to number. So we have learned anodontia and supernumerary teeth. Supernumerary teeth also known as hypodontia. Anodontia we have total, partial, false and pseudo. Supernumerary we have two types of classification based on location and morphology. MESIODENS, paramolar, distomolar, para, premolar, conical, tuberculate, supplemental odontomes. Odontome we have two type, complex and compound, which is coming under composite. So I'll come up with developmental disturbances of shape or form in my next video. Thank you.